Thank you all for joining us for this month's Roundtable Live. I'm joined by a panel of really innovative public health professionals who are excited to share on this topic. I think that it's an ongoing discussion. As long as we have people who still don't understand public health, and as long as we kind of stumble to explain it ourselves, we need to keep having the conversation about defining public health in plain language so that people understand and we can have these conversations that flow about what we do. So that's what we're here to talk about today. So thank you for joining us live. If you're watching the replay, we appreciate that. We'll go around and introduce ourselves and before we get into the topic, but I will start with introducing myself, and then we'll just kind of go around. My name is Dr. Charlotte Huntley. I am the CEO of Dr. C.H. Huntley, LLC. We are a public health consulting firm that focuses on really supporting large nonprofit organizations communicate their health information in plain language. We're epidemiology specialists, and also we really focus on BIPOC communities or the organizations that serve BIPOC communities. I'm also the host of the Public Health Epidemiology Conversations podcast, where we bring on a variety of professionals in the field of public health to discuss their journey into public health and what they do, and again help to shed light on the various ways that you can work in this field. So I'm going to pass over to Zainab. Why don't you introduce yourself?
Hi everyone, thank you, Dr. Huntley. Super excited to be here, especially because it is Health Literacy Month. So there's no better time to talk about plain language and explaining things clearly so people can understand. So love the timing, Dr. Huntley, of this. Again, my name is Zainab Shipchandler. I'm a Master Certified Health Education Specialist and a public health consultant at my consultancy, ZRF Group. We work with organizations to develop health education for communities and also for training and providing, continuing development education for health professionals and public health professionals. And we really are focused on health literacy, which is really, in my opinion, about us making health information easier to understand, easier to access, so people can make those most informed decisions and take the best health-related actions for themselves and their families.
Good afternoon, everyone. I am Ericka Horne. I am a certified health education specialist, and I am also the CEO and founder of Akiri Consulting. And currently with my business, what we do is we provide support to nonprofits and faith-based organizations with regards to program planning, implementation of events. So that includes day of events, speaking at events, emceeing those health events, and ensuring that all the logistics are prepared for those events. And also being a certified health education specialist, ensuring that the topic of health literacy is something that we actually complement and ensuring that people understand what we are trying to explain to them in a way that's culturally relevant and competent to the communities that we serve. So that's just a little bit about what I do now.
Hello, everyone. My name is LaShonda Richardson, and I am the founder of Emerge Public Health and Community Development. Emerge is designed to educate, motivate, empower, restore, grow, and evolve the communities. Emerge hosts community events and provides resources to the community for them to be able to make informed decisions about their health and wellness. We also work with, similar to Ericka, but with faith-based and nonprofit organizations, just providing resources, allowing them to have everything that they need to be able to just work within their communities to be healthy, to make informed decisions. So that's who we are.
Defining public health in plain language. I'm not sure why this has really captured me so much. I think that, trying to meet the need, and from my perspective as the podcast host and engaging with so many different people, and also in a niche area like epidemiology where it always feels complicated, it's really good for us to address this and to continue to talk about it. So what I would like for each of you to do is to take a moment and share, how do you define public health in plain language in any setting? If it's personal settings, if it's more casual business settings, if it's in a formal setting, you decide. But how do you define public health in plain language? I know for myself, I often will explain the population versus individual kind of approach. Sometimes in a previous conversation, we talked about comparing public health to healthcare, but sometimes when people ask me, well, what is public health? And you can almost tell that the question is coming just by the way they look on their face, where they don't want to insult us by asking because they feel like they should know. So I will just simply explain the difference in, population. Our focus is on population health, as opposed to if you go to your medical doctor, he's looking at, or she is looking at you as an individual, one person, one patient at a time. Whereas in public health, we are looking at populations of people. So maybe the population may be women of a certain ethnic group in a particular age group, or maybe a certain geographical area, and as it relates to a certain condition. And we're also really focused on prevention. So it's not that we don't care about treating. Of course, we care about treating the conditions, but we really are focused on preventing. We want to prevent this from even, becoming an issue. So those are some of the two ways that I sort of approach the conversation, and I wait for their response to kind of guide, what I say next. So Zainab, I'm going to pass it over to you. And just keeping it, how do you define public health in plain language?
Yeah, so I completely agree with everything that you said, Dr. Huntley. That's exactly the same way I generally break it down for people is, population versus individual, and preventing disease, or, promoting good health, right? Even if people are healthy, how can we make them healthier? But I find that sometimes people still don't really get it, and they really want to know, what do I do as a public health professional? What does my day-to-day look like? And they want something a little more concrete. So I guess my overall takeaway advice would be for us to try to be specific and give specific examples to really show public health in action. Because I think that's really the missing link, is showing people what we actually do on a day-to-day basis as public health professionals. So this happened to me not so long ago, where someone asked what I did. And this was like more of a social situation, someone who I just know from my community. And I gave an example, like, I do public health education. I helped to develop a workshop that helped people identify trusted health information, like, for example, on COVID-19 vaccines. So that person was like, well, COVID is over, so now what do you do? So I was like, okay, well, that's your perspective. I know COVID is still among us, unfortunately, but that's the thing. Now we can't just say it's, oh, well, public health, remember what we did in COVID? They want to know, well, what do you do now? So I explained my current work, that's training clinicians and health professionals on clear communication with their patients, such as using, plain language, explaining jargon. And so it was really cute. She was like, oh, so you're a doctor for doctors. So that was really sweet. But I think just hearing an example, that kind of, finally she was satisfied, and that light bulb went off of what is an example of what somebody does in the public health field.
And it's really interesting. It's almost like we have to read body language to figure out, are they understanding, or do they want more? Because sometimes I've been guilty of giving too much, and they're clearly like, it's like way too much right there. But finding that balance and those examples are important. And you're right. They want to know, like, well, what do you do? So that's great.
For me, I would say similar to how you explained initially about population versus individual health. But one of the first things I do is always kind of get to know who I'm talking to first. So I'll ask questions, whether it's to the community, to the individual, and just kind of gauge their understanding in general. And then I can give an example based off of their understanding. And that's kind of where it is with like health literacy, is understanding where people are so that you can provide them with information at the level so that they can understand. So I was speaking to a family member, and I'm Jamaican American. So the understanding of health is different in America versus in Jamaica. And just being able to explain what I do as far as community engagement work, and how we provide different resources to the community, or connect them to the community and the resources that they have. And just explaining that, just think about the whole village where you're from, as opposed to just when you go to the doctor, but then also breaking it down even more, because understanding that there aren't that many healthcare professionals in Jamaica. So it's not as if, oh, everybody has a doctor. That may not be common conversations or topics. So I kind of try to get to understand the person that I'm communicating with first, and then bring it to their realm of life, their scope of what they experience, and bring it to them so that they can understand it from the lens that they're seeing life through. Because I can always give my example, but if they're in a whole different frame of mind, they're not American, they're not in America, they don't even know what health is, it doesn't benefit them because then they still don't understand. So that's one of the first things I do is find out their understanding and try to bring it to their level. And then also considering where people come from outside of their background. So when I talked about that being culturally responsive, culturally competent, understanding that some systems, some areas, they may have had to pay for school. So it's not necessarily, everybody doesn't just get to go to school for free. They may have stopped in second grade. They may have stopped in fifth grade, and then bringing it down to the level. And even if they may have stopped in eighth grade, sometimes they may not have been on that level when it comes academically. So what level did they actually stop at with their education? So I really try to take it back to the individual, understanding what their level of knowledge is, just to also let them understand that I'm on their side. Like, I want them to understand instead of always talking so high that they would never understand what I'm saying. I try to bring it down to a place so that we're having just a conversation. So if the only thing they know is nursery rhymes, I'm going to find the nursery rhyme that relates to public health in a way for them to understand. I just try to really be authentic and really think about the individual that I'm speaking with. And I actually had that experience when it came to with my family this week. I was able to do that and share, about public health. And they were able to give me some additional insight that I didn't even consider, but it took me being able to get down to their level and get to just whatever level, not necessarily down, but just get to the level that they're on and their playing field so that we could be able to have a conversation about it. And then another thing that comes to mind when I think about public health and explaining it is even when it comes to like healthcare providers. I know Zainab, touched on it briefly, but just making sure that they understand how do they approach these communities as well. So a lot of times we consider, sometimes it's a misunderstanding of cultures, a misunderstanding of body language, and just being able to, provide that as a resource for physicians and how they work and healthcare providers. So maybe not just doctors, but maybe nurses and PAs, and helping them understand, hey, that's not what that exactly means when you go into the doctor. When they come to see you, this is what that means. And so it kind of helps them and allows them to be better providers for their patients that they see one-on-one. So that's kind of what I do in my approach to like using plain language in public health.
I completely agree. It is just meeting people where they are and having them to have a clear just understanding of what public health is, having people to understand that it's making lifestyle changes. And what would you be able to do if you could play with your grandchildren, or, just do everyday things that you wouldn't normally be able to do if you chose healthier foods, or if you chose to move your body. Having people to understand that it's about lifestyle changes. It's about changing the outcome of your health. And I love the fact that we were talking about with families, because we can also be that resource for them when they go to the doctors. I found an article, it was talking about questions that you should ask the doctor when you go, because we have a lot of people, you go in and, the doctor may see you and they ask open-ended questions. Are you okay? Yes. Did you eat today? Yes. But not just it being a one-sided conversation, but actually being able to know what to ask so that you can actually make better choices about the condition or, the thing that you may be going to the doctor for, and just building trust within the community. So when I'm talking about public health, I really want people to understand that it's about lifestyle changes. It's about promoting health. It's about reversing diseases that are reversible, like some things we have because of how we eat or our lack of exercise or things of that nature. So just making sure that people have the information that they need to be able to make healthy lifestyle changes and understanding what that means. One thing that I always ask people or my clients or that I'm working with is, you say that, a lot of people, or there's this this saying that you're going to live until you die. But my question is, what do you want your quality of life to be while you're living? You can have a much better quality of life if you're able to understand small changes and small things that you can do to be able to enjoy your families or do anything like that. So just meeting people where they are, being a trusted resource for the community, and helping them to understand that we are promoting health and that we're an added resource for the community in addition to what you would see as an individual going to your doctor's office or something like that.
So yeah, I think this has been an awesome conversation. I've definitely gotten a lot of great ideas from everybody. I think what stuck in my mind is the nursery rhyme to explain public health, because honestly, sometimes, little poems, little songs. I remember during the pandemic, I got a little baby book about, I think it was like epidemiology for babies or, something like that. And I feel like my daughter understood the basic concepts of how disease spread and how to prevent disease from that. And she was, I think, 2 years old at the time. So it's possible. It really is possible if we take that effort. And like you said, like both LaShonda and Ericka mentioned, meeting people where they are, whether they're a 2-year-old, whether they're 95 years old. I think we can just take the time it takes to get to know the person and explain it in a way that's relevant to them. So I absolutely loved this conversation. Thank you all so much.
So as Zainab mentioned, the nursery rhyme, I thought about how, during the pandemic, everybody had signs up about like washing hands. So they had like twinkle, twinkle, little stars, sing this as you wash your hands. And that's how you know if you've reached the 20-second mark. Like that's how you know. So even just little things like that really stick, because then people start asking, well, why do I have to sing for this long? And then you can answer, well, this is how long it takes for this to take place. So just little things like that really do make a difference. And even when LaShonda was speaking, it made me think about how, as consultants, as public health professionals, we're here to help guide others and being able to provide and be a resource, but it also empowers individuals to be in charge of their own health. So yes, public health is of the community population, but when you're individually empowered to take care of your own health, then you can help the next person, and then that helps the community, and that eventually will help the entire, the state, the country, the world, So if we can really empower individuals to take ownership of their health, and that's through the initiatives, through preventative health, through promotion of health and wellness, we really are still empowering everyone, and we're impacting the community on a much grander scale.
I think it's important for us to, as we get excited about the work that we do, and there's so many ways that we can, infuse these takeaways into the work we do. But I think it's important for us to also remember that the initial thing of really explaining public health, like these, ways that we can explain it to them so people can start to understand what it is that we do and why we're trying to talk about all these other things and why we're trying to help. And it does, like, once that understanding, this is how I operate as well, but I think once that understanding is there, they understand what public health is, and then we start really engaging with them, meeting them where they are to explain and to advocate whatever it is that whatever direction we're trying to help, then they're much more receptive. And people don't like to be told what to do. None of us want to be told what to do. But if we understand what it is and the why and the approach, then we can make our own decisions, right? We just need to be, make sure that we're leading with this truth and understanding of what public health is and how we serve in that area, so that people then are open to hear from us, and it builds the trust. And then they're, of course, being able to confidently make those decisions based on that understanding.
So first, I'll say I really, really enjoyed this conversation. And I think, just to add to it, I think that we are change agents to make change agents. I feel like we, as public health professionals that work in the community and that consult, if we're able to change one person in the community that is able to share their story. I feel like, people like to see fruit. And if we can get one person to change and share that, then we can start to get the community involved as a whole. Once people start seeing, I can do this, I can make this decision, I can make this change, and this is how it affects me. So if we come alongside each other and teach the community, if we can get one person at least, and that's how I feel, if I can get one person to change, if I can get one person to understand, I feel that this person can be a testament that the small changes that you make can make a huge impact in your life. And once we start doing that, we can start, it just becomes like a chain reaction. People start to catch on when you're working, and you just start building people up. And I think someone spoke about confidence, like, people being confident to speak their truth and to say that I did this to be able to change. And, and change is hard for some people, but when they see the effects of it and they see that it works, we can just start building people and create this chain of people that are living healthier, that are doing better, that we're changing traditions. And not that tradition is bad, but sometimes it can, lead to things that aren't healthy for us to do it on a consistent basis. So creating balance and just being those change agents for the community and making change one person at a time.
I definitely enjoy the conversation. We will continue to host this type of conversation because I think it needs to be ongoing. I encourage all of you to comment on this and share your thoughts. Not just look at it as a burden, but as a privilege and an honor. Be excited about helping to explain public health. There are a lot of people who don't understand and don't know. So let's just kind of turn around, be more excited about explaining. It's an opportunity to, shed the light on this topic and the subject with one person at a time, right? Well, thank you all for being here. I appreciate you. I always look forward to hearing from you and value your insights and feedback. So thank you all, and we will see you again next month for the Public Health Roundtable.